I'm Daniel Bolton. I'm the Trauma Medical Director at Valley Baptist. I'm additionally a double board certified and double fellowship trained surgeon and a fellow of the American College of Surgeons. I've been a physician for over 25 years now. I originally trained as an osteopathic physician and practiced family medicine in New Zealand, and then I trained as a surgeon in 2015. I went to St. George's Medical School, and then I did residency at Yale and in Florida. I additionally did a trauma and critical care fellowship at the University of Kentucky, and I did a burn and reconstructive surgery fellowship at Yale. I originally got into medicine about 25 years ago after I left the Army. I wanted to find some way to give back to my community, and then I decided to become a surgeon because I felt that I had more to give as a physician, and have continued from there. So I came to the Valley approximately 3 years ago. There is a high degree of need here in the Valley, and I service those both by my role as the Trauma Medical Director, but also as a surgeon here. So my practice involves a full sphere of practice into general surgery, but additionally I do a lot of complex reconstructive surgery. So we make sure that patients who have had any significant complications or problems from previous surgical procedures or wounds, that we're able to reconstruct those. I do a lot of minimally invasive surgery. I utilize the robotic platform quite extensively. This way we can try and get these more complex operations done through smaller incisions, less time in the hospital, faster recovery time, lower infection risks for our patients. Valley Baptist has been instrumental in helping me to develop not just the trauma program here, where we serve over 1 million people a year from a trauma standpoint, but also they have invested heavily in robotic platforms and minimally invasive surgery platforms, in collaborations with the community and our partners in the community to make sure we have a seamless flow of access for our patients. My practice of medicine and surgery is to put the patient first. We need to make sure that we're optimizing them in all spheres of their life. So it's not just the fact that we're going to do an operation, but making sure we optimize their health in general. The most important outcome for me is seeing them return to not just full function, but also having a full life with their family. The strength of working in a fully integrated surgical team is that the entirety of my team are very, very highly skilled surgeons that are going to provide exemplary care and operative care to the patient. That we work as a team, so we think in very similar ways, but we're also very questioning to make sure that we provide what is right for that patient at that particular time. These are very stressful times for a patient. We want to make sure that we get them through those in the best way possible. Obviously, nobody wants to be in that situation, but what you do want to have is very capable surgeons who are able to assist you in your recovery. The great thing about being here at Valley Baptist is we have the fantastic integration of service lines to make sure that all your care is met at all times.